With that, it's my honor to introduce Mr. Jon DeLena, the DEA Associate Administrator, all the way here from Washington, D.C. to speak at our coalition.
Thank you. Ava, congratulations. Kaylee, great job, and to have your mentors and teachers from SNHU here, I think it's incredible, and it speaks volumes to some of the things that are happening in a room like this. So great job. DEA.gov for your application. Forget about state government. We have plenty of work for you. In fact, you should talk to us after. Let's get an internship lined up for you too. So good morning, everybody. It's awesome for me to be back here and to see so many great, friendly faces. And while this is an uplifting day, I'm going to talk to you a little bit about what I think is our nation's greatest national security, public safety, and public health threat today, fentanyl. And I'm going to speak very honestly and openly about it all, and I'll be happy to answer any questions at the end. As many of you know, and as Celeste has said, for the last 2 years or so, I've been down in Washington, D.C., working with our administrator down there, but any opportunity for me to come home, where my heart is, which is right here in the Granite State, I always take advantage of, and I don't think I've missed one of these events since around 2016 when I first came to New Hampshire. It means a lot to me to be here. But in those 7 years or so since I first came to New Hampshire, the world has changed dramatically. It really has. The drug threat that we're dealing with today is unlike anything I've seen in my 28 years with DEA and 5 years in local law enforcement before that. It's something that has just impacted all of our communities. It's transformed the way we look at this crisis. In 2022 alone, DEA seized 59 million fake pills made with fentanyl. That was enough to kill every single American. This year, we are on track already we've already seized over 65 million of those same fake pills, with 3 months left. So we'll be well over 70 million pills, fake pills, deadly pills, that will be seized in this country by DEA. I can't help but think back as I was sort of wrapping my head around what I wanted to talk about today. I remember the first presentations I gave in New Hampshire. And I remember at the time I was talking about how 64,000 Americans had died from a drug overdose back then in 2016. And I remember standing in rooms like this saying, if the following year the numbers were 70,000 or 80,000 or 90,000, it wouldn't change the way that the cartels do business. It would have no impact on them whatsoever. And I thought a lot about back then, and I would always say that there's going to be a time in this country where we look back and study this point in our nation's history. Study, how could this have happened in our country? How could we have lost so many Americans to drug overdoses and drug poisoning? And I would also say, whenever I would talk like that, I would say that the next chapter in those same history books will be about how we turned it around. And I believe that, I truly believe that there will be an opportunity for us to turn it around. That's why I'm committed to being at events like this with amazing people like all of you, because that the youth leaders that I see and I saw up here today, I'm so proud of what you're able to accomplish, and I put all of my hope in the future of this country, on people like you. So let's talk a little bit about fentanyl. It's cheap, it's easy to make, it's easy to disguise, and it's deadly to those who take it. Just 2 milligrams. You've probably seen the visual images that DEA has put out. It's literally enough to fit on the tip of a pencil. And 2 milligrams is enough to kill any one of us. And the pills that these cartels are making are more deadly than ever before. 7 out of 10 of the pills that we're seizing in our lab come back with a potentially deadly dose. 7 out of 10 of the pills contain a potentially deadly dose. And the numbers will keep going higher and higher and higher. But as challenging as this threat is, we know who's responsible for it. There's 2 cartels in Mexico, the Sinaloa cartel and the Jalisco cartel, that are essentially producing all of the fentanyl that's coming into our country. And everybody needs to know that. Everybody needs to know that's who's responsible for it. They are a global criminal enterprise. We have identified them in every state in the nation. We have identified them in over 50 countries around the world, working to produce this drug, this synthetic drug, that's changing all of our lives. And as I said, they're putting this fentanyl into everything that they can possibly imagine. The question came up about marijuana. When I say they are a billion-dollar global criminal enterprise, they will stop at nothing. They will stop at nothing. So while they're manufacturing pills right now that look identical to pharmaceutical-grade pills, they will put that drug into everything they possibly can. Adderall. I remember standing in front of the microphones of WMUR years ago, talking about how it was the most insidious, despicable thing I had ever seen a criminal organization do. By taking a drug like Adderall and mixing it then with methamphetamine, and now it's gotten worse. And now they're making Adderall with fentanyl in it. They know it's young people, mostly, that are appropriately being prescribed and using Adderall. They also know that young people are subject to possibly sharing those drugs with their friends. So they are mass producing Adderall laced with fentanyl. They're targeting our youngest generation. They're poisoning Americans unlike ever before. And I get asked the question wherever I go, why? Why would an organization like that produce a drug that's killing off essentially their customer base? And the answer is simple. There's hundreds of millions of more Americans behind them on social media and places that they can easily reach that they want to addict. They want to addict everybody that they possibly can. They're on Snapchat, they're on TikTok, they're on Instagram, and they know that if they happen to kill one of their customers, there will be another one right behind it. They are driving demand because they are greedy. And it is a billion-dollar industry for them, essentially based on greed. So as a leader of an organization like DEA, there's always things that, we say keep us up at night. What keeps me up at night, I guess, which is the opposite of my spark, is what can I do better to protect my communities? What can I do better to protect the most vulnerable that we have in our communities, which are our youngest generation? And what worries me is that the cartels now have taken to social media unlike ever before. And what we describe it as is essentially that's how they're completing the last mile, how they're getting those drugs into the hands of people within all of our communities. As I said, they're using every application possible. They're on Facebook, Instagram, TikTok, Snapchat. They're using WhatsApp, Telegram, Signal, anything they possibly can has become their superhighway for drugs. When I was a local police officer, and even as a young DEA agent, you had to know a drug dealer to buy drugs. But now, and I have 2 of them sitting over there right now, all you need is a phone. And everybody that has a phone in their back pocket or in their purse right now can be connected to a drug dealer, including our children. And we know that the cartels and their local organizations are using those applications to specifically try to target our young people. I've now met with, tragically, so many parents who have lost their children to drug poisoning death that somebody during COVID or somebody after was on social media, somebody approached them about what they thought might have been a pharmaceutical drug, only to tragically find their children dead from a drug poisoning. Let me make this perfectly clear. You cannot buy pharmaceutical drugs on the internet. You cannot buy pharmaceutical drugs on the internet. However, many people think that you can, and these cartels continue to target Americans by putting those ads up there and trying to make people think that they're getting an Adderall, a Percocet, a Xanax, when they're not. As of today, the CDC, and Celeste used the slide, 110,757 Americans died from drug poisoning deaths in 2022. And as I said a few minutes ago, I remember standing up in rooms like this talking about 64,000, thinking how much worse could it possibly get. 70% of those drug poisoning deaths that we know of are from synthetic opioids like fentanyl. And as Celeste said, 486. 486 in the Granite State alone. And we think we're doing amazing work here, and we are. But there's still too many that we're losing. And it's more than COVID, it's more than car accidents, it's more than anything else that's out there. It's the leading cause of death right now between 18 and 45. And most of us are in that sweet spot of that age right now, probably with the exception of me, I'm the oldest here. We started something in DEA headquarters that we call the Faces of Fentanyl, and it started sort of as a call to action. And we asked families that, because we started working with so many of these families that have lost their loved ones, we asked them if they wanted to share a photo. And I can tell you that right now, the walls of DEA headquarters, out by the museum, if you're ever in DC, you should come see our museum. But we have over 5,000 pictures up right now, 5,000 of people that have been lost to this drug poisoning epidemic. The youngest is 11 months old. The oldest is 70 years old. I say all the time, when I look at it and when the employees of DEA walk by that every single day, what we see is the faces of America. You see soldiers in uniform, you see kids playing. There's nobody at this point, nobody, that's essentially immune from it. It's impacting everybody. No community in the United States is immune. New Hampshire is not immune. Raymond is not immune. And that's what drives me to come to things like this, to continue to push. I know that I'm not going to stand by. I'm not going to stand by and come back again in a year or 2 years from now if the numbers continue to rise. If it's 150,000 now, what if it's 200,000? Are we going to stand idly by and let that happen? I know nobody in here wants to do that. I know I don't. So let me tell you that when we finally do stop this, and we will, and like I said, that'll be a chapter in a history book of how we do it. It's going to be started in rooms like this, where a coalition of the willing comes together, and the energy and passion of these young people starts to move us, the way it moves me every time I come here. And I believe that, and I hope you understand that. So let's talk about what my moonshot idea is, and it echoes the visionary spirit of President John F. Kennedy. Just as President Kennedy ignited the flames of ambition with his challenge to reach the moon, because there was a time when we didn't reach the moon, kids. Today, we stand on the precipice of a mission that is no less ambitious, no less crucial, and that's ridding our country of a drug like fentanyl. Kennedy had famous words back then, and I always remember them. He said, we chose to go to the moon in this decade and do other things, not because they are easy, but because they are hard. Underscore that profound commitment. It was defined an entire era back then with what we're trying to do now. It's in that same spirit of perseverance, in the face of daunting challenges like the one I'm talking to you about now, that we must channel all of our energy and confront this crisis, threatening all of our communities and all of our families and all of our homes. We need to think big. We need to be ambitious. We need young people to start and help us get there. This insidious drug, which has brought death and destruction through all of our communities, more so than we even want to think about, it has a grip on us, but it's time for a change. We must ask ourselves, as Granite Staters, or even as a society, if we're willing to stand idly by, while this silent assassin continues to claim lives and devastate our communities. So just as President Kennedy's moonshot, that mission aimed to unite our nation with a common purpose, we too must come together. We must recognize that we're not just combating a substance or a cartel, we're safeguarding our communities, our families, and our future. I don't take that lightly. So I challenge each of you to be part of my moonshot, to lend your strength, your voices, your passion to this cause. I want to continue to work together to prevent the tragedy of another lost generation. No more numbers like 110,000 Americans dying. Just as our predecessors came together to achieve the impossible and reach the moon, I think we can finally put a stop to this. So in Kennedy's spirit, with his determination, I say we have to strive to remove this country from this grip of fentanyl. I want a country, I want a New Hampshire, I want a Raymond, where our children and our future generations can flourish without fear. We don't have to continue to put slides up there that really make all of us think twice. They make all of us say, I need to go home and have a conversation tonight with my children. We can make that vision a reality. I believe that, well, it sounds like a moonshot idea, or it sounds a little bit crazy. I wouldn't be standing here telling you that I think it can happen if I didn't believe in it. So I hope you all will join me in that fight. Thank you.